I think we're live. I'm just going to double check and make sure I can see myself on Facebook, and then we are good to go. Check the live video tab. All right, we are live. Welcome everybody to the Boys Town Pediatrics Fall Newborn Expo. I am so excited to see you all live here. My name is Gabby. I'm your host for the week, and we are going live every single day to better help you prepare for baby. So kicking it off strong today with Dr. Monica Kelly. Dr. Kelly, how are you today?
I'm well, thanks, Gabby. How are you?
Good. It's great to have you on. We're going to be chatting about feeding, so both breastfeeding and formula feeding. As we go through our live discussion, you are more than welcome and encouraged to leave any questions that you have on feeding in the comment section of this video. If you want to communicate privately, you can always send us a direct message to our Facebook page. Maybe you don't want your question to be public quite yet. You can send it that way, and then we're going to do a live Q&A at the end. And all comments on this video are going to qualify you to be entered into today's giveaway. And that item is going to be for today. It's a stuffed elephant chair with baby reading books. So if you want to be entered to win now as we're live, go ahead and leave a comment. I also want to call out just one more thing before we hop into the discussion. We are doing a in-person newborn skills workshop this Saturday, October 14th. So if you're nearby Omaha and want to come, the sign-up link is right above this video, and we'll put it in the comments as well. All right, so hopping right into feeding, Dr. Kelly, please go ahead and introduce yourself and tell us more about your role at Boys Town Pediatrics.
So Dr. Kelly, obviously I work at the main campus office, so the big hospital that's on 140th and Pacific. I've worked for Boys Town now for 5 years. I have 3 children myself, so I have a 5-year-old, a 3-year-old, and a 1-year-old.
Awesome. Well, it's great to have you on, especially, being a mother yourself and a pediatrician. We kind of get to see both sides for a lot of our parents who are expecting. So great to have you. Okay, so let's start by talking about, like I said, we're going to kind of hop back and forth between breastfeeding and formula feeding in this video. So first, let's talk about breastfeeding, and then could you tell us a little bit about the pros and cons going into both?
Mm-hmm. So for breastfeeding, there are lots of pros for breastfeeding. Yeah. For nutritionally, it has the most complex nutrition. So it's great for baby's brain, especially has lots of different compounds in it. There's no way that a formula could mimic everything that breast milk has in it, although the formula companies are getting better and better at trying to mimic that. And then it also has a lot of immune cells in it. So it both has immunoglobulins and then also actually live cells in it from the mom. So it protects baby against a lot of diseases. So babies who get breast milk are less likely to get ear infections and stomach bugs and asthma, things like that. It also protects against obesity later in life if you get breast milk when you're a baby. And then for the mom, there are also benefits. Traditionally, they say it's easier for moms to lose weight if you breastfeed, although that's not true for everyone. It's supposed to be better for postpartum depression because of the oxytocin that you get when you breastfeed your baby. Do you want me to do cons now too?
Yeah, good.
So, yeah, I'm sort of hitting a little bit on the cons. So I would say the biggest cons in breastfeeding are for mom, and the most of them are in the first few weeks. So it is really a challenge for a lot of people in the first few weeks, just because you are the only person who can feed your baby if you're breastfeeding in the first few weeks. I mean, obviously you could pump and someone could give a bottle, but you still are responsible for making that milk. And then you need to build up a milk supply. And the only way of doing that is by emptying frequently. And so for those first few weeks, baby needs to eat often. So often babies will cluster feed and they'll want to eat almost every hour for the first few days. So then you feel like you're getting very little sleep. Often it's hard to kind of get babies to learn how to latch at first. So that can be quite a challenge for people. But and then once that's established, if you get through that, another con of breastfeeding is just long-term, you still are, you either need to be with baby or you need to have time set apart to pump. And then some women, although they say breastfeeding helps you lose weight, that's true for the majority of women. Some women find that they can't lose weight until they wean their children. And then as soon as they wean, they lose that weight. But one of the things I do want to say is that most of the cons of breastfeeding are temporary. So a lot of people get really discouraged, but if you stick through it, most of the time they get better.
Yes, that's great to know. Perfect. And then formula feeding, could we talk about some of the pros with that and then some cons?
Mm-hmm. So I think the biggest pro for formula feeding is its ease, especially, so it's sort of the reverse of breastfeeding. It's ease, especially in the beginning. So you're not the only person who can do it. Dad can do it, grandma can do it, whoever, everyone can help you out. Babies get more milk from a bottle initially. So it's normal when you're breastfeeding not to have a lot of milk at first. So babies sleep better for the first few days when they're formula fed because they're getting more milk. They're happier because they're sleeping more. And then the moms don't get as tired because they're able to have other people help. And then just going forward, anyone can do it, which is great. Also, occasionally you'll have a baby that has a hard time gaining weight. And then with formula, it's nice to know that you know exactly how much they're getting. Occasionally, if babies have a really hard time gaining weight, we want to give them higher calorie. And so formula is great for that because you know exactly how many calories are in there and you can make it higher calorie with specific recipes. The main cons of formula feeding are that it doesn't have the immuno properties. So it doesn't protect your baby from disease in the same way that breast milk does.
Yeah. The next question is, how can parents best prepare themselves both physically and mentally for breastfeeding?
So physically, when you get close to birth, so really once it would be safe to deliver baby, you can start doing, so once you start breastfeeding, it can be quite difficult on your nipples. They get sore, but you can prepare for that by putting nipple cream on before you deliver, and that can actually make quite a difference once baby's born. But the nipple stimulation can, in very rare circumstances, induce labor. So you want to wait until it's safe for baby to be born. Then you can do that. And you can actually start pumping at that point too. And that just kind of tells your body to start making the milk. So then your milk comes in a little faster once baby is born. So that's something you can do physically. And I think mental preparation, two things are really helpful. One is just becoming knowledgeable about breastfeeding. So learning how to latch baby. So there are, for instance, great YouTube videos on how to latch baby correctly, or even taking a breastfeeding class, or finding a support system around you of people that can help you. A lot of pediatricians in town, myself included, are breastfeeding specialists that, just to be aware of those people that can help you. And then to know that it's going to be hard, but it's temporary, the difficulty. And so kind of mentally prepare that it's just something you have to push through, but it will get better.
Yes.
There are lots of people to support you through it.
Mm-hmm. Yeah. And Friday of this week, we're actually going live with a behavioral health licensed psychologist. And that whole topic is mental health surrounding baby and mom and dad and giving birth. So, if that is something that you're especially thinking about when it comes to preparing for baby, just know Friday we have that whole chat is going to be centered around that. So very important. Mm-hmm. Wonderful. The next question is, how can parents deal with feeling frustrated or disappointed if, maybe they plan on breastfeeding, but are either having trouble or aren't able to, or, maybe they try it and it's not really working out.
Mm-hmm. Mm-hmm. Yeah, so I think it's really important to know that the most important thing for your baby is to be fed and to have happy parents. So are there benefits to breastfeeding for the baby? Absolutely. Is it better for your baby for you to breastfeed them and be miserable? No. It's better for your baby for you to feed them a bottle and be happy than for you to try to breastfeed and be miserable. So depending on how it goes, there definitely are circumstances in which it's just not going well. And I think you need to feel okay with the knowledge that what's important for your baby is that they are fed, they're loved, and you're happy. And you're not in any way a failure if you formula feed your baby. They're going to do great in life. And no way of failure.
So we talked a little bit, I know when you were talking about formula with ounces, how do we know how much to feed our baby, both when it comes to breastfeeding and formula feeding?
So in the first few days of life, babies don't need very much at all. So it's normal. So when you're breastfeeding, you first have colostrum. You really just have drips basically of colostrum at first. And so even if you're formula feeding, you want to kind of mimic that because baby stomachs are really small at first. So we normally talk when talking about breast milk in mLs, which to put that in perspective, there are 30 mLs in an ounce. So it's a really tiny amount. But the first day of life, a baby needs about 5 mLs, which is about 1/6 of an ounce every feed. And then the next day they need about 10, which is about 1/3 of an ounce. And then the next day they need about an ounce. And the day after that, about 2. And then once because their stomachs progressively get bigger, once they get to that point, so about 5 days a week of life, then they need about an ounce an hour. So depending on how long you're going between feeds, it's about an ounce an hour. So like if it's been 2 hours, that'd be 2 ounces. If it's been 3 hours, it'd be 3 ounces. And then going forward, most babies, it's an ounce to an ounce and a half per hour. And that's the same really bottle fed or breastfed. Most of the time, bottle fed babies end up taking larger volumes less frequently than breastfed babies. Most breastfed babies want to eat more frequently and eat less at a time. But when you're actually feeding the baby at the breast, you don't really need to worry about how much they eat most of the time. You just feed them until they stop eating and then you're done.
Right. What are some of the other mental challenges do parents face during feeding, particularly breastfeeding?
I think one thing that parents struggle a lot with is knowing how much their children are getting.
Yeah.
And a lot of women don't understand that it's normal not to have a lot of milk at first. Sure. So I hear a lot of mothers say, like, I feel like I don't have any milk. And you're like, yes, that's normal. You're not supposed to have milk yet. Right. And they're like, babies seem so hungry and eating all the time. That's normal. They're eating all the time in order to make you have milk. So that's definitely one. And then if some children have a hard time gaining weight and it's nerve-wracking for parents not to know how much they're getting because you put them at the breast, you don't really know how much they're getting. So sometimes in clinic, we'll do something that's called a weighted feed where we'll have them come in and weigh the baby before you feed them and then weigh the baby afterward. And then we can say exactly how much baby's getting, which is very reassuring for people to see exactly how much they're getting.
Yeah.
Then women also worry a lot about their diet when they're breastfeeding. So because you feel like, okay, everything I eat matters. And for the most part, that's not true. So your body is really good about filtering what you eat and only giving good things to babies. So I would definitely recommend eating healthily while you breastfeed just for your own sake. But even if you were to eat McDonald's most days, your breast milk would still be healthy because your body gives the baby the healthy stuff.
Good parts. Definitely. I did skip a question that we had. What formula brands do you recommend?
So all the major US brands are pretty similar. We don't recommend anyone specifically. I would recommend sticking with US brands because they're FDA regulated and not getting imported ones.
Perfect. I see a lot of great questions coming through in the comment section. Just know we are saving them all for our Q&A at the end. So keep leaving them, and we appreciate all of you watching and leaving all the nice comments. If we want to pump, where do we start and when?
So occasionally we'll recommend starting to pump right away if you have a preemie or if your breast milk isn't coming in like we would expect it to, then we just want that little extra stimulation in the beginning. But for most people, we want to keep it as long as possible, just mom and baby, because that regulates your milk the best. But then depending on when you want to go back to work is kind of when we decide when it's best to pump. So you don't honestly want a huge freezer stash, although everyone feels like that's a great idea. And it's a nice, comforting thought to have a huge freezer stash. But if you have a huge freezer stash, you've made yourself have an oversupply, which is not really ideal. So a couple of weeks before you go back to work, maybe like 3-4 weeks, you can start pumping once a day. It's best to pump in the morning after you feed baby because then you have the most milk anyway. And then you can normally have enough milk just from doing that you have plenty for going back to work, but you don't induce an oversupply.
Yeah, perfect. We just have a couple more questions and then we'll get into the Q&A and then after the giveaway. At what age do we start introducing food? I know this is a little farther down the line, but think about.
So sometime between 4 and 6 months, and it's actually dependent on your baby's developmental progression. So you want them to have 3 things. You want them to be interested in food. You want them to be able to sit mostly unsupported, so they can be in a high chair but not super wobbly. Mm-hmm. And then if you put food in their mouth, they should not spit it out, because that's a reflex that babies have initially. So once they do those 3 things, then you can start feeding them. And it's very exciting to feed your baby real food.
Yeah. Oh my gosh, so fun. Okay. And then what tips do you have for parents eventually when they begin to wean?
Yeah, so normally some point between 4 and 6 months, you introduce the food. Between 6 and 9 months, you're mostly working on introducing different allergens. You want the 7 major allergens. You want to introduce all of those and different textures. Make sure you're doing all different sorts of vegetables and things so your baby is introduced to lots of different things. And then between 9 months and a year is when you're starting more of the weaning process. So I have people cut out 1 milk feed a month from 9 months to a year. And then most of the time that gets you to a year, you have 2 milk feeds at that point. And then if you're on formula, you would just switch to cow's milk. If you're on breast milk and you want to stop breastfeeding, you would also switch. But if you want to continue breastfeeding, you can continue at that point until you're ready to be done.
Perfect. Okay, so before we get into the Q&A, thank you for all of these tips, Dr. Kelly. Before we jump in, if our live viewers want to schedule a free meet and greet with you, if they're expecting, how can they do
that? They can call our office, I think is the easiest way.
Yeah.
And our number is, I believe Gabby will put it on, but it is 531-355-6900. And then I think there's also a link, right, that they can sign up for it.
I'll link it below for you guys, but
yeah.
Okay, wonderful. Well, let's get right in. We've got quite a few questions, so I have them on my phone here. Make sure we can get to as many as we can. So thank you for leaving them. If you are watching this video maybe later tonight or the next couple of days and you weren't able to ask a live question, but you still have one, go ahead and message our page directly, and I'm happy to forward to Dr. Kelly. Okay, so the first one is, can breast milk help prevent autoimmune diseases? First-time mom, and I have rheumatoid arthritis.
That's a great question to which I don't know the answer.
That's fine.
Yeah, I don't know, but yeah. Sorry.
That's okay. We already talked about diet, so you can go back and watch that part. Recently, my baby has been falling asleep at the breast. Does that mean that he is getting more than what he was originally and is being satisfied? And should I be using my Spectra pump instead of my, excuse me if I say it wrong, Haaka, Haaka?
Yeah, Haaka. So baby falling asleep at the breast can be from a lot of different things. So it depends a lot on your baby. So I hesitate to give advice not knowing your baby, because with their little or premature jaundice, they sometimes will fall asleep even when they're still hungry. Certainly if they're older and growing well, they normally don't fall asleep until they're full. The Haaka it collects with much less pressure than the Spectra. So it depends how much milk you're trying to get, Haaka versus Spectra. But great question to ask your pediatrician.
Yes. What are the best ways to keep up supply for breastfeeding, especially when returning back to work while baby is at daycare?
Yeah. So frequent expression is best for keeping up supply. So ideally, you pump as many times as your baby eats. So however many bottles your baby's getting at daycare, then you would pump that many times at work, which can be hard for some people, but that's the best. And then making sure you're staying really well hydrated. Um, Interestingly, staying well hydrated with an electrolyte drink seems to be better than just with water. And then making sure you're also staying eating plenty. Don't work too hard on trying to lose weight.
Yeah. How can the non-gestational parent make breastfeeding easier for the parent breastfeeding?
You can do all the non-breastfeeding things. So changing baby's diaper, burping them. If mom's breastfeeding, you can, and needs a drink of water or something, you can go get them. Some people have the non-gestating parent wake up every time, which I think is a little excessive because it's good to have one parent be well rested, I think, as long as baby doesn't need something else. But I think it's totally reasonable if baby needs a diaper change, if the one parent breastfeeds and then passes off to the other parent to change the diapers so that you can go to sleep faster. That's very helpful. And then certainly sometimes babies wake up at night and don't need to be fed. That would be great if the other parent takes care of them at that point.
Yeah. And we just put together a new resource that we're sharing this week, and it's called 10 Conversation Starters Before Baby Arrives. So a lot of this stuff is great to talk about before baby comes. So who's going to do what, everything like that. So we'll link that in the comments as well. Okay, the next question is, after baby is born, when should I start pumping to start a supply for when I go back to work?
So we kind of covered that, but it depends on when you're going back to work. I would do a few weeks before. It does depend a little bit on how. So if you feel like you have an iffy supply as it is, you can do it earlier. Some people just naturally have a really oversupply, and then I would caution pumping too much. Although in circumstances like that, you can use a Haakaa. I don't know if other people know what it is, but it's a device that you put on the side you're not nursing on, and it collects milk while you're nursing on the other side. That you can start collecting milk earlier. But if you have a lower end of supply, it doesn't hurt you as much to start pumping earlier.
Do babies have more wet diapers if they are formula fed versus breast milk fed?
They shouldn't. They should have the same number of wet diapers.
Which is better, doing times feeding like 15 minutes one side, or letting the baby eat on one side and then switch to the other side the next feeding? Do I need to pump the side she is not eating to keep my supply while breastfeeding? We kind of just talked about that.
Yeah. So whether to feed all on one side each time or do both each time totally depends on your storage capacity, which gets a little involved. But every woman has an amount that their breast can store, basically, of milk. So if you think about it like a cup size, not like a bra cup size, but like a drinking cup size, different drinking cups can hold different amounts of liquid. If your breast, which is not necessarily related to the size of your breast, if your breast can hold a lot of milk, then you can easily hold enough, for example, for 6 hours on one side, then it might work fine to just feed on one side each time. If you can only hold a smaller amount, you'll want to feed on both sides each time. Because if you ever get to the max of your capacity in that breast, then you're starting to tell your body that you have more milk than you need, and you're telling your body to stop making milk. So you never really want to get too past your max storage capacity. That's a sort of involved answer, but
no worries. Okay, the next question is, what can be done to promote more milk production?
So it's really all supply and demand milk production. So expressing frequently is your biggest bet for milk production. There are, so like if you're breastfeeding them often, if you're pumping often, but then they also have these protocols for like power pumping, where you do kind of bursts of pumping over an hour. And then it is definitely also helpful to be really well hydrated, to have great nutrition. And then there are some things that you can eat that promote making milk. So like oats and brewer's yeast. And there's certain kinds of tea that are good for making milk. I really think ice cream helps make milk.
Mm-hmm.
But that has not been studied. That's just anecdotal.
Yeah. Very good. Okay. When it is safe to deliver the baby, is it okay to start expressing and saving the colostrum so after baby is born, you aren't scrambling to get it?
Mm-hmm. Yeah. So yeah, as soon as you're like 36 weeks, you can start pumping, and then you'll probably only get drops, but you can save it, and then you can supplement baby with it when they're born.
Awesome. Is it normal for baby to have hiccups after every single feeding?
Yeah. Lots of babies have hiccups all the time.
Perfect. Okay. Is there a certain brand of bottles that's recommended to not affect the latch and still help prevent gas?
There are so many different bottles that claim to do different things. I don't think any of them have been proven to be the best. Yeah. The NICU seems to always use Dr. Brown, but I think that's just because it's easy. They think the latch for the baby is easier, not necessarily that it's easier with breastfeeding confusion.
Mm-hmm. Yeah. And just a reminder, one of the topics this week is when baby has tummy trouble. So make sure to watch that one if that's a concern of yours. What are your thoughts on toddler formulas meant for 12 months and up? Pros and cons to that?
So most of the time, you'd hope your toddler is eating well enough solid food so that they wouldn't need toddler formula. Toddlers are notoriously picky. I know I now have my third toddler.
Yeah.
And they also are a little bit like snakes in that they'll do one good meal and then not eat well for a few meals. So you really do need to look at their nutrition over the span of a few days rather than each meal. Sometimes they are more picky than the normal toddler. And I think in that situation, it makes sense to do a toddler formula. You always want to make sure you're not giving it to them instead of offering food. So it's a tricky balance because you want to encourage the eating of food, but not have them not get the nutrition they need. Right. So yeah, to be used with caution.
Sure. The next question is, when do you have to stop breastfeeding? First time mom writing in.
Yeah. So there's no end date, no required end date. The AAP recommends breastfeeding recommends breastfeeding through a year. The World Health Organization recommends through 2. And there's no age that people have said it's unhealthy. I think most people find it a little weird to breastfeed an older child. Mm-hmm. So most people stop sometime between 1 and 2 or earlier.
Perfect. The next question is, I had to triple feed with my first. Should I expect to need to do that with my next baby?
Not necessarily. So there are definitely the 2 players in the game, so both mom and baby, and it really helps if one of you knows what you're doing. Mm-hmm. So often the triple feeding has to do with latch, it has to do with how fast milk is coming in, it has to do with jaundice levels, but it also has to do with just how, the latch is partially baby latching and partially just mom knowing how to get baby latched. So there's, baby's not jaundice this time and you know what you're doing, you may very well not need to triple feed.
Sure. Okay, we'll do 2 more questions for the Q&A and then we'll go ahead and spin the wheel for our giveaway. So thanks everyone for watching, and just know we have 5 more opportunities to win this week if you don't win today. What tips do you have for latching a baby who has a slight tongue tie?
So latching, kind of everyone is the same sort of tip. So this is going to look sort of weird, but if you can imagine that on the wrong side, that this is a boob, so this is your nipple. Okay. And then if this is baby's mouth, you want them to come in from the bottom, so you sort of tickle their top lip. and then get them in like that. The problem with the tongue tie is ideally you want the tongue to be out and underneath like that. The tongue tie kind of doesn't stick out enough. So you really need to encourage as much of the boob going, like as much of the tongue going under the boob as possible with that.
Mm-hmm.
Normally, if the baby can get their tongue to their lip, like you can get a good latch. If they can't get the tongue to the lip,
Mm-hmm.
it may need to be clipped.
Mm-hmm. Great. And then the last question is on waking the baby up for feeding in the nighttime. Do you have to wake the baby every 3 to 4 hours to feed? I guess that's all day and night.
Yeah. So it depends on their age and their weight.
Okay.
So initially babies lose weight, and then you don't want them to go more than 4 hours without eating. If they lose a lot of weight, you don't want them to go more than 3.
Mm-hmm.
So then you definitely want to wake them up. Once they start gaining weight again, you have a little more leeway. And then once they're back to birth weight, most babies do fine without being woken up. Mm-hmm. So most babies, once they get back to birth weight, you can let them sleep, even if they do like 6 hours. That's, a miracle baby, but let them do it.
Yeah, definitely. Thanks for answering all those on the fly. I know with the very first question on the autoimmune question, I do want to let you know that we do have a lot of different specialty services at Boys Town. I forgot to mention, but we do include pediatric rheumatology. So if that's something that you want to look into, we will make sure to comment and leave that resource for you if you want to do any follow-up on that. Okay, so the moment we've all been waiting for, drum roll please. The giveaway winner is, let me spin this wheel on my phone. All right, hopefully you can see this. Angel F, you are a giveaway winner, so congratulations. We'll message you from our page to claim your prize. And like I said, we're doing giveaways every day this week at noon for our lives. Tomorrow, we're going to be live with Dr. Daniel Emson, and that's going to be what happens at the hospital. So I know a lot of you expecting parents who commented probably want to tune into that. And it'll be great. So Dr. Kelly, thank you so much for your expertise and always jumping on these lives with us. It's very appreciated.
You're welcome.
Awesome. Well, thanks everybody. We will see you tomorrow and have a great rest of your Monday. Bye-bye.